So, how to survive? The first thing is, I'm not sure, I'll ask you now, how many of you actually are consultants now? Anybody? No, so you're all just in those final years waiting to apply. I know it's very tempting to apply for the first job you see, but in general, this is going to be the job for the rest of your professional life. People do change job. I changed jobs. I was a consultant surgeon in London initially. I had a very nice job actually in central London as a vascular surgeon, and I moved to Wales because my husband at that time had got a job here in Wales. So people do move, and I think people move more now than they used to, but there was a time, and there still is a little bit of time, people are interested why you want to move jobs. If you decide 5 or 6 years into your consultant job that you're going to move, and there's always an underlying question of whether you are actually moving because you're a square peg in a round hole and you don't fit in. So try, if you can, to apply for a job that you want, okay? Now these are two quite important points. When you go for a job interview now, you don't have to have someone representing the college on your interview panel, but I would suggest to you that you're a little bit selective, because if you have a representative, an advisor from the college on your interview panel, you will know that that job description follows the job description that we've approved, and that the job description gives you adequate time to be with your patients, direct patient contact sessions, but it also gives you SPAs, which are those sessions for supporting professional activities. Some trusts nowadays, particularly the foundation trusts, which we don't have in Wales, but you have in England, particularly the foundation trusts, fiddle around with the job description a little bit to try and take your SPAs away from you, to try and make you do more direct clinical sessions. And although initially when you were appointed, you may think that's okay, as time goes on, you will want sessions for other things, okay? You want to be protected, and you want your job plan to be protected, and you want to do not apply for a job if you look at the job plan and you see that your on-call commitment is overly arduous, and people will try and do that. They will try and appoint you, particularly in areas where recruitment is difficult, as in parts of Wales. They will try and appoint you to posts that the college wouldn't approve, okay? And if you take those posts and you run into trouble, you will only have yourself to blame. Okay, I remember when I was a senior registrar, I know training has changed now, and you actually have to move on. When I was a senior registrar, I was desperate to get a consultant job. But just remember, while you're in a training post, you're in a protected environment, you're learning. You have someone to ask advice from. So don't jump for a consultant post. If your training program director says, possibly we'll give you a bit of extra time, maybe you need it. Do not find yourself in a consultant post unready. Take every training opportunity available to you. And more nowadays, you can get a post-CCT fellowship. Welcome it. The more surgical experience you get prior to becoming a consultant, the better. And of course, you can even ask for training time after you've been appointed, if you feel there are gaps in your ability. Choose the right job. Just remember, I know Tim is going to speak after me, and Tim's going to speak more about work-life balance, but however wonderful your job is, however ambitious you are, however much you want to be a consultant surgeon, there is more to life than surgery. You will not be on your deathbed saying, I wish I'd done another aortic aneurysm. You'll be on your deathbed saying, I wish I'd gone on that big holiday to Kenya when the kids were small. So consider your lifestyle, consider that when you take a job. Consider your family and consider your ambitions. Are you going to be an academic surgeon? Are you going to be in a big regional centre? Would you prefer a quieter life, being more of a generalist? Think about this. Think about this before you jump. Do not get in the wrong job. There is nothing worse than finding yourself in a department where you don't like your colleagues and your colleagues don't like you. When you are first appointed as a consultant, of course you want to hit the ground running. Of course you want to do the surgery that you've been trained to do. You want to do big surgery. You want to really crack on. But I would suggest to you that you take your time. The thing I remember when I was first appointed were two things particularly. First, having gone from a very busy senior registrar job, working for 2 bosses, and then becoming your own boss, you suddenly are not doing nearly as much operating. So I don't think I ever was in theatre as much as the last few months of being a senior registrar. You're doing the emergencies, you're working for 2 bosses, you're constantly in theatre. When you become a consultant surgeon, you actually usually have a day major in main operating theatre, 2 sessions there, and then probably another half day doing day surgery. Suddenly you're doing actually less operating than you were doing, and you have to get used to that a little bit. The other thing you have to get used to as a new consultant is actually there seem to be big gaps in your week. I mean, when I first started, I was thinking, this is very, I'm not doing anything. Just hold your breath and wait a little while and just work out how things are, because you will get busier. I mean, now my week is just completely chock-a-block. So things do change. Any good trust should give you an induction program so that you can get to know the other people, not just in your department, but the management structure. The president spoke about the structure of the NHS. Most big hospitals have a hugely complicated management structure as well, and it's worth getting to know the people in your institution. I almost think this is the most important slide. So no man is an island, no woman is an island. Just ask people, be humble. First thing is be humble. I hate to say it, but you're not the dog's bollocks. You've done well, you've become a consultant. Do not annoy your older senior colleagues. They might be a difficult group, but be humble, ask people things, take advice. If you are unfortunate and something goes wrong early on in your consultant career, admit it. I'll tell you, when I started as a consultant vascular surgeon in Lewisham, my slightly senior colleague there was a chap I'd known when we were SHOs. We never liked each other. We particularly didn't like each other when we became consultants. He was obviously gunning for things to go wrong with me. And they did. Almost my first on call, had a ruptured aneurysm. Ruptured aneurysm didn't do very well. I probably shouldn't have done it actually, but ruptured aneurysm didn't go very well. I'd been taught by a consultant that the way to get who I worked for, the way to get out of trouble with a ruptured aneurysm when the top end was really turning into a disaster was to tie off the top end. So basically tie off the aorta and then revascularize the legs by doing an axilla by fem, which is true. It's a really good get out of jail free card. So I did that, got the guy off the table, thought, phew, fantastic. Done it, went home, went to bed, came in the next morning. The guy was alive. Unfortunately, his right arm was ischemic. So, because I had done a terrible anastomosis up in the axilla and the blood supply to his right arm had gone off. So almost my first week as a consultant, things are going wrong. My colleague hates me. But I would suggest to you, your best thing under those circumstances is to talk to as many people as possible. Admit your errors. Never try and hide an error. Never hide an error. And of course, nowadays you have a statutory duty of candour to speak to patients and speak to relatives when things don't go as you would wish them to do. And I know it's hard. I know it's hard to talk to someone and say things have gone wrong. But in the long term, it's better for the patients to understand. It's better for people's family to understand. It is better for your sanity to admit to your errors and be open. Nothing worse than hiding things. And nothing worse than hiding things and being found out to hide them. Be nice to everybody, okay? Be particularly nice to senior nurses. I don't know what you've found as junior doctors. I hate to say junior doctors, sorry, it's a derogatory term. I hate to wonder, but as a trainee, I was always told, be nice to senior nurses, and it's absolutely right. When you're a consultant, you want the ward manager or the chief sister on the ward to be on your side. You certainly want your theatre sister to be on your side. Any nurse around the place, you want to help you, okay? But there's someone I've missed off here, and I've only realised I missed it off when I listened to Tim Mitchell speak yesterday. When you are appointed, one of the most important people in your life for the next X number of years is probably going to be your anaesthetist. And when I was appointed to my London job, I was actually extremely lucky because the guys who were going to work with me as the vascular anaesthetists were actually interviewed at the same time for me. So we were all three of us, new consultants, arriving at the trust at the same time. They were particularly interviewed and appointed to be intensive care and vascular surgical anaesthetists. So when I operated on big cases, they had the same interest in the cases as I did. So it was wonderful. They wanted our aneurysm results to be fantastic. They wanted our carotid endarterectomy results to be fantastic. And then they were looking after the patients on the ITU. So your anaesthetist is going to work with you for a long time, hopefully. And they're going to have to put up with you taking a long time over cases when they don't go right. They're going to see you when things go wrong, and you and they are going to be almost like a married couple, if you're lucky. And if you do work in the private sector, as most of you will a little bit, I'm not suggesting that you work a lot in the private sector, but if you do private practice, it's also very nice to have an anaesthetist you know who comes to do your private lists. Because when your patients get sick in the private sector, as a consultant surgeon, you probably don't want to be the one worrying about their fluid balance or worrying about their sodium level. You want to know that you have an anaesthetist you trust, who you know, who will work together with you. Okay, you're a team. The next most important person in your life, I think, probably is your secretary. Some hospitals now don't give consultants secretaries in the same way as I'm lucky enough to have, but your secretary organises things. She can make your life, she or he, I suppose these days, can make your life difficult, can make your life very easy. Okay, be nice to your secretary. And again, senior nurses, be very nice to them. Okay, be nice to your consultant colleagues. You know, if you don't get on with your consultant colleagues in your direct department, if you're colorectal department, what have you, you will not have a nice life. You know, when you go on holiday, when you want to change the rota for the on-call, you want people slipping. And what's more, you want to be able to trust their ability to look after your patients, and you want them to trust that you are actually capable of looking after their patients. It's particularly important in vascular nowadays, of course. Are any of you vascular surgeons? Right. So in vascular nowadays, most places, you're centralising your emergency vascular service. And in many units now, once you've operated on a patient, other colleagues will be the ones who look after them. So you need to be able to trust each other. Look after your junior doctors. I've put team here specifically because in my day, of course, we'd call it a firm. I still call my group of juniors a firm, but you work much less closely together with your own registrar, your own senior registrar, your own SHO and your own house officers than you used to. But be kind to your juniors and look after them because you've been there. And if you want them to be supportive of you, then you need to be kind to them. I've got some people here who worked for me over the years, and I'm sure I was kind to you, wasn't I? Yeah, thank you. Yeah. Right. Never forget why you're a consultant. So sometimes I've had to shake myself a bit on this one. You know, when you are a vascular surgeon, I'm speaking for myself, and this is probably a character flaw on my part. When you are a vascular surgeon, there is a fairly high attrition rate in vascular surgery. Or it may just be me, but you know, there seems to be a fairly high attrition rate. And sometimes when things don't go quite as you would like them to go, you get cross and you get dissatisfied and you go home and you're irritated, and you're irritated because it hasn't gone right for you. Well, it's not about you, it's about the patient. So your job is, okay, you're all very ambitious, you've all worked very hard, you've got to where you want to get to. It is about the patient, just don't forget that. And it might mean, therefore, that you don't do an operation that you could do, because the best thing to do is not operate. I think I've already said this. It will not always be that quiet is a really important one to take home. You hopefully will get into your post. You will get used to what your timetable is like. Just give yourself a bit of time because you are going to want to develop some other interests. Okay? As I've said to you, you actually spend very little time in surgery, in the actual operating theatre, and you're going to be a consultant surgeon for 30 years, possibly longer, the way retirement times are going. you are going to want to develop other interests. And it may be that you're an academic and you want to do research and you want to be an academic surgeon and be interested in that. That's great. You might want to get into management. Personally, I was always interested in training the registrars, and so I went through the training program. I became a member of the training program. Then I was doing things like being member of faculties, you probably already are, for things like CRISP and the ATLS. Then you become faculty lead. Then, of course, national recruitment came in, so I was part of the pilot study for national recruitment and developing the national recruitment system. Then you become program director. So these things all take time, but you need to do it if you want to, number one, be good at your job, but number two, retain an interest. You know, there are consultants who go to the dark side very heavily, and you know they don't have any of these interests. You know, they don't run the training program, they don't become clinical director because they do spend 2 days a week down the road earning lots of money, and you know they drive a lovely Mercedes, whereas I drive some clapped out old Mitsubishi. But you have to go what turns you on. You know, it's not all about the dollar. Be nice to everybody. So during your first year, you want people to learn to respect you. Of course, when you first arrive in the hospital, you know, everyone's judging you. Unless you were the pet senior registrar who's come up through the ranks in that hospital, who everybody already loves, and you just walk into a consultant job. If you're a new person in a new region, people are going to be judging you. So you want to be very nice, hardworking, but safe and sensible. You know, do not, at your peril, set off doing high-risk surgery when you're newly appointed. Okay? Of course you'll want to, and of course if the case comes up, you'll think, okay, yes, I'll do the carotico-aorto-iliac posterior tibial bypass. Of course I'll do the esophago-rectal anastomosis. Of course you'll think that. But take my advice, if you're going to do something ambitious like that when you're a baby consultant, ask one of your senior colleagues to do it with you. You know, people do, when I was first appointed, you thought it showed a lack of cojones to ask for help. You know, you're a consultant, you'll get on with it on your own. Now, people do operate together much more than they ever did, and I would suggest that you form alliances with one or more of your senior colleagues, someone you can get on with, who will be happy, I'm sure, to give you advice generally, to mentor you a little bit, and to come into theatre and help you. Nothing worse than making a mess of something than having to call someone at the end of the afternoon. Don't rock the boat. I mean, once you're established, fine. If you don't like the way the department's run, of course you can try and make changes. Do not rock the boat early. It'll be a disaster. I've already touched on this. If something goes wrong, admit it. You have a duty of candour. It's when the duty of candour became law, people were very anxious and frightened about it. You know, if you admit error, does that put you at risk of being sued? Of course, we all have these, you know, gross negligence, manslaughter cases hanging over us. You really have got to be very unlucky for that to happen, but you do have a duty of candour. And in my experience, most patients and most patients' relatives react better if you talk to them openly and fairly. You know, they realise that you are unhappy about what's happened and that you're upset. But communication is key. There will still be people who will complain, even if you have been open and honest, and there will still be complaints, I'm afraid. It's unavoidable in the present environment. But be honest, be open, talk to your colleagues. Of course, nowadays you'll have MDT meetings, you'll have audit meetings. You know, it's your duty to be open and honest. As I said, if you know something is going wrong, ask for help. And always make sure you document what goes on. Document at the time. If you do go back and make a note later, make sure that you have made it clear that that note was written later. Never try and rewrite the note later without making that clear. So you are lucky. You actually have got one of the best jobs in the world. As I said to the medical students yesterday, there is such a huge variety in surgery. You've chosen your surgical specialty, which you already have done. But then once you're a consultant, these days technology is changing all the time, so you're going to be learning new skills. But intellectually, you can go off on different channels. You can train, you can be an academic, you can be a medical politician, you can be a medical manager. There is a huge amount of intellectual stimulation, and if you want to be a consultant for 30 or 40 years, you have to remain interested. Otherwise life gets very tedious. I think that's all I said there, but the one thing I was thinking yesterday is, we talked yesterday about bullying, harassment and undermining. It's very easy, actually, as a young consultant to feel undermined, okay? But that's a natural thing. We're all sensitive, and it's easy to feel undermined when possibly you're not. But is that because you want me to shut up now? The last thing I will say, and Tim may say differently, I always made it a rule. So when I became a consultant, I had 2 children. Then I got bored and had another one because I didn't have enough to do. You see, as I said to you, my week wasn't full. So I thought, okay, give it a go. I said to my husband, if you can get me pregnant before I'm 40, we'll have another baby. So bang, crash, wallop. So then I had plenty to do on a weekly basis. But what I would say to you is, keep your work and your life separate. I made it a rule when I became a consultant that I was working at work, I was not working at home. I was not bringing work home with me. Of course, now I end up bringing some work home with me because of college, but it is not necessary to bring work home with you, okay? There's plenty of time during the week to do your work, okay? You go home, and I would suggest for your sanity as much as anything else, go home, you know, ride your bicycle, play with your children, cook dinner, whatever. As I said at the beginning, when you die, you will not wish you'd done one more ruptured aneurysm. Okay, thank you.